Hey everyone, and welcome back to the Deep Dive. We're always looking at the latest and greatest in ketamine treatment options, and we know a lot of you are really excited about the idea of personalized ketamine therapy. And, well, we might just have something really interesting for you today. There's this groundbreaking study that could change how we think about personalizing ketamine treatment.
Yeah, you know what's so cool about this study? It actually doesn't directly involve ketamine, but it uses this similar psychedelic called DMT and hints at how we could personalize treatment in a really exciting way.
Okay, so let's break this down. This study was published just this month in Neuropsychopharmacology, and it's all about DMT, which is short for N-dimethyltryptamine. Now, DMT is a powerful psychedelic, just like ketamine, and they both work in similar ways.
Yeah, through the same pathway in the brain, the serotonin 5-HT2A receptor.
Okay, so think of it like this. That receptor is like a lock, and these psychedelics are keys that fit into that lock, and when they do, they can change your mood and how you see things.
And this study is really interesting because it tested this new way of dosing. They call it self-guided titration, and they did it with DMT. And the results could totally change how we personalize ketamine therapy in the future.
So that's what we're diving into today. We're going to break down the study's findings and explore how this self-guided approach could revolutionize ketamine treatment. And get this study was super legit. They used what's called a double-blind, placebo-controlled crossover design. That's basically the gold standard in research. It makes sure the results they're seeing are actually real and not just random chance.
Exactly.
You had 22 healthy participants, a mix of men and women, and they put them through a bunch of different sessions to see how different doses of DMT affected them.
That's important. That really rigorous design helps to rule out any chance or bias, so we can be more confident in the findings. They really wanted to make sure that letting people adjust their own dose of DMT during a psychedelic experience could lead to better outcomes.
Right, they weren't messing around. So they tested a few different DMT dosing methods. But the most interesting one for us is this: a continuous intravenous infusion of DMT over 120 minutes.
Now, a continuous infusion that's different from just like a quick injection, because it makes the effects come on much more gradually, kind of like slowly turning up the volume knob instead of just blasting the music all at once.
Cool, I like that analogy.
Yeah, it makes the whole experience way smoother and more tolerable.
Okay, so that makes sense. But here's a really crazy part. The participants could actually adjust their DMT dose every 40 minutes. They could decide how intense they wanted the psychedelic experience to be.
Like they had their hand on the dial shaping their own journey.
Yeah, exactly.
Now imagine that same idea applied to ketamine therapy. What if you, the patient, could have more control over finding the dose that feels just right for you?
That's what I'm talking about.
Sure.
So what did they find out in the study? Well, the DMT infusions produced what we call dose-dependent psychedelic effects. Basically, the higher the dose, the stronger the effects.
Exactly.
But then the effects kind of plateaued after about 30 minutes. So picture this. You're in a therapy session, and the effects gradually build up. And then they level off at a place where you feel comfortable. And you can start exploring things with your therapist.
Right, that plateau is really important. It means the effects stabilize and you have time to process and work through things. You don't feel like you're constantly being swept away by the experience.
Right. It's about finding that sweet spot. But here's something super important they found. DMT's positive effects, they peaked at a certain dose. Taking more didn't always mean you felt better.
Yeah, and sometimes even higher doses actually made people more anxious and increased the negative experiences.
That's a really good point. More isn't always better with psychedelics. This shows us that personalized dosing is key. We need to maximize the benefits and minimize any potential discomfort.
Exactly.
And get this, in the self-guided sessions, the participants actually chose to go pretty deep. They reached psychedelic effects comparable to the highest tolerated fixed dose from the other sessions.
Wow, so they weren't afraid of the intensity.
Nope. And the amazing thing is this: even though they were choosing to have strong psychedelic effects, this self-titration didn't increase negative side effects.
So feeling in control, having agency over your own experience, it could actually enhance both the safety and the effectiveness of psychedelic therapy.
That's incredible. And that's where we'll pick up next time on the deep dive.
Yeah, it's like knowing you've got a safety net so you can take that leap of faith. And when you trust the process, it can really make a difference.
That makes a lot of sense. So, I'm sure some of you are thinking, okay, this is all really interesting stuff about DMT, but I'm here for the ketamine. So how does this self-titration thing actually work? with ketamine therapy?
That's the million-dollar question. And while this study doesn't give us all the answers, it definitely gives us a roadmap for future research. It shows us that personalizing the dose and giving patients some control could be a game changer for ketamine treatment.
So let's imagine what this might actually look like. Let's say you're thinking about trying ketamine therapy. You'd start by meeting with a qualified medical professional, someone who's trained in giving ketamine and guiding people through these experiences.
Right, and it's important to remember that this isn't just about finding the right dose, it's about finding the right experience for you. We all respond differently to psychedelics, and this therapeutic journey is deeply personal.
Absolutely. So imagine this. You start with a lower dose of ketamine, and then under the guidance of your therapist, you can actually adjust the dose during the session.
Yeah, the goal is to reach a level where you're feeling the therapeutic effects without being overwhelmed. It's all about finding that sweet spot where you can access those deeper emotional and psychological states that can really help with healing.
Now, I know some people might be thinking, wait a minute, giving patients control over their dose during a psychedelic experience, isn't that kind of risky?
Oh yeah, for sure. That's a totally valid concern. Safety always has to come first. That's why the therapist's role is so important in this model. They're there to monitor your progress and provide guidance and support. And most importantly, make sure you're safe throughout the entire experience. It's about finding the right balance between empowering the patient and providing responsible ethical care.
It's a collaboration, right? It's a partnership between the patient and the therapist, where the patient's needs and preferences are honored, but it's still in a safe and structured environment.
Exactly, and that's what makes this research so exciting. It's not just about new ways to use ketamine, it's about changing how we think about power in mental health care, giving patients more say, and ultimately creating more personalized and effective treatments.
So I'm curious, what are some of the challenges in actually bringing this kind of approach into real-world ketamine therapy? I imagine there are a few hurdles.
Oh, absolutely. There are definitely challenges, and it's important to be realistic about them. I think one of the biggest challenges is figuring out how to standardize this approach. Ketamine therapy is still relatively new, and there's a lot of variation in how it's done and what doses are used, so we'd need to develop some clear protocols and guidelines for this type of personalized titration.
And training would be a big part of that too, right? Therapists would need the knowledge and skills to safely guide patients through this kind of self-guided experience.
Exactly. And then, of course, there's the issue of access and cost. This kind of personalized approach with the self-titration, it might require longer sessions and more individual attention, which could make it more expensive and maybe even less accessible for some people. Those are real-world factors that we can't ignore.
Yeah, those are really important considerations. But even with the challenges, the potential benefits are pretty huge, right? The idea that we could tailor ketamine therapy to each person's individual needs, increase the chances of positive outcomes, and actually empower patients to take an active role in their own healing. It's definitely something worth exploring further.
It really is. And remember, we're still just scratching the surface of what ketamine and other psychedelics can do for mental health. This study is a step in the right direction, and there's so much more to discover.
It feels like we're on the verge of something big. Like this DMT study is a sneak peek into the future. We're on the launch pad ready for takeoff.
Absolutely, and the possibilities are incredible. Imagine using technology to track people's responses to ketamine in real time, and then fine-tuning the dose and experience to be super precise. Or what if we combined other therapies like mindfulness or breath work to create a truly holistic and personalized treatment?
Okay, now you're getting me really excited.
Yep.
It feels like we're on the edge of a revolution in mental health care. And this DMT study is like a signal flare showing us the way.
It's a call to be bolder, to think bigger, and to never stop looking for better ways to help people.
So for all of you listening, what does this all mean? Well, knowledge is power. If you're thinking about ketamine therapy, do your research. Talk to qualified professionals and stay up to date on the latest developments.
Yeah, and don't be afraid to advocate for yourself. You have the right to ask questions, to explore your options, and to choose the path that feels right for you.
This is your journey. Your voice matters. Your experiences, your feedback, your insights, they're all crucial in shaping the future of mental health care.
Because ultimately, it's about creating a system that prioritizes individual needs, that empowers patients and helps people find lasting healing and well-being.
Yeah, it really feels like we're moving away from that old one-size-fits-all approach to mental health care, and we're starting to embrace the idea that each person's journey is unique.
Totally. And even though this research was about self-titration with DMT, it really shows us what might be possible with ketamine therapy, too. Like, it's a beacon lighting Boy.
It all comes down to this. Healing isn't something that just happens to you. You have to actively participate in it. And maybe with this kind of approach, we can finally give people more control over their own healing journeys.
Right. Imagine feeling empowered to explore those psychedelic spaces, knowing you can adjust the intensity and really shape the experience to what feels right for you.
And knowing you have that trusting relationship with your therapist, they're there to guide you and make sure you're safe every step of the way.
Absolutely. That therapeutic alliance is so important. It's all about creating a space where you feel heard and understood and supported, even when things get tough.
So for everyone listening out there, I hope this deep dive has given you a sense of hope, a glimpse into what the future of ketamine therapy could look like, and the amazing potential of personalized treatment.
Yeah, keep asking questions, stay curious, and don't be afraid to advocate for your needs.
Exactly. Keep learning, keep exploring, and stay tuned. Because the world of psychedelic medicine is changing fast. And who knows what incredible discoveries are just around the corner.
Until next time, happy diving, everyone!